Okay. Without spending much time, I will request Ganesh to introduce EduFuture as well as Swarupama. Over to Ganesh.
Thank you, sir, and namaskar to all of you, all the participants. Very subtly to the point, we have started this organization by name EduFuture, which Swarupama is one of the founding directors, along with another gentleman by name Hari Kishan. The idea of starting the exact organization is to assist all educational institutions, very specifically the medical science institutions across Pan India, in achieving excellence in terms of learning and teaching, excellence in research and publication, and excellence in student support and patient care. So this was the activity that we started with. And since Swarupama, this is what EduFuture is all about. So when I have to talk about Swarupama, she's completed her master's in medical anthropology from the University of Pune. And apart from that, she has an amazing, work on the ground work with Nari, where she was where she had completed a lot of project under Nari, which is in terms of understanding the women productivity, where she's done a lot of work over there. Then again, she's worked with ICMR. She was a research assistant, where there also she's worked understanding the women's reproductive health concerns in context to HIV and AIDS. She's worked on that. Then under the Pune University, she's worked for UGC major research, which is called inheritance of fingerprints. Then again, under the University of Pune, she's worked as an information resource exchange, a rural community connectivity project, which was an ISRO University Pune project. And apart from that, she's been a consultant. She's worked as a principal academic and quality assurance accreditation of audits of education institutions on pan-India basis. And apart from this, she also has been for ICMR, which I've already mentioned. So now going forward, she's working on her PhD, which in our experiences, after having worked with so many medical institutions, they still find the medical institutions, apart from the support of the government, the state and the central government, there is a lot of opportunities to come out with a better health India. That is our motto. And which is also supported by the government of India as of now under Ayushman Bharat. Then apart from that, also we have where the government of India is supporting starting with lifestyle diseases, how exactly we can overcome them, beginning with obesity. So this is where we decided connecting with medical institutions on a pan-India basis, go to rural areas, create a medical kit where we are talking about AI-related activities. So this is a very, very brief introduction to the time given to me. Thank you for everybody. And Swarupama, please take over.
Yeah, over to Swarupama. Please go ahead.
Good morning to all. Thanks, sir, for the introduction. And thank you, Dr. Vilas, sir, also, for giving us the opportunity. Yeah, as Dr. Ganesh mentioned that EduFuture is into quality enhancement for medical institutions and other health science institutions also. So taking a hint from that, when we went to other institutions also and saw that the effectiveness of the things which the institution is doing is not measured or properly articulated. So in this, be it taking our experience, we thought that we will also do a project. And as I was doing my PhD and the topic was also related. So this is where we came out with that we develop a kit or say the portable devices, medical devices, which can be put in a kit and then that can be used as a preventive healthcare system or establish a system in the rural and semi-urban areas. And we, as a part of my PhD, I will be studying the effectiveness of this delivery system. So coming to the topic and EduFuture's project, this presentation which I will be doing will be a mix of both. It is not only thesis or my subject presentation, as we are in the, I'm in the initial stage of it. So I will be taking you all through the things what we are considering, things which we have done, and the things which we are going to do in future. Okay, so coming to the background, as we said, we had EduFuture had call it experience in education institutions, and we saw many places where we can improvise them and have a effective way of implementing the project. And the background of health science projects also gave us a leverage to understand the needs of the semi-urban and rural conditions where the healthcare is delivered. And that is where we started initiating this project. And during our consultation or giving advice to the institutions, we also came across that the government is also providing many initiatives. Like they have given insurance for the community or the people, and where the people can what do you say, take leverage of the insurance. And but this has not been very effective as of now. And when we say the government has also done an initiative in December, where they have taken the health status of the rural people, which was under the Prakriti prediction, where the institutions were also roped in to take the survey and fill the online information for the Prakriti prediction. And the government has also, as Dr. Ganesh mentioned, that it has also come up with a initiative of lifestyle disease improvement, and the first target is reducing the obesity. That is also, and this health science institutions also have a mandate that they should adopt villages wherever they are based in urban setting also, or metro setting also. The institutions are encouraged to adopt villages and do their community outreach programs in the villages. So this is majorly done by health science institutions. The adoption of villages is also done by many technical other like engineering and other institutions, where they help in social work in that, do the social work in that adopted village, and have a holistic development of that village. So health science institutions also go and deliver their camps, and they also go and conduct the camps and have health checkups. They have awareness over there. And this is where when once the NEP 2020 and the curriculum, CBCS curriculum was enrolled by the statutory bodies of health science institutions, the outcome of any activity was to be measured, and that is where which it triggered that if we have a proper mechanism where which can be documented also, and the outcome also can be measured, and other benefits also can be given to the institution and the community at large, it will be very helpful. So that is where we started the project. So significance of preventive healthcare is preventive healthcare is focused on preventing diseases before they occur, and this contributes to a prolonged life expectancy and improve quality of life, and also makes the community healthy. So that is what we are also taking into consideration. And the cost effectiveness, it reduces the burden of the society at large, and is also affordable and can be treated very effectively at the initial stage. And chronic diseases burden is also reduced, and it also minimizes the hospital visits and the treatment procedures which are carried out. Once the disease is occurred, the things are at a different level. They would have to go to the first the things which are like they have to get under the control the symptoms, and then go in for a change in lifestyle. But if we have this at the start of the disease or before the disease occurs, it is very cost effective. The challenges in rural health are the PHCs or the facilities which are provided by the government and some private institutions, they are very difficult for the residents to receive timely and necessary healthcare services, because they have a limited staff also. That is where we are saying that the healthcare workforce is also at shortage. So the patient care or the workload is not managed, and the patient have to have frequent visits to the healthcare facility. And then the initiative taken by the community is not as much, as it comes to when they are at really at pain, they will visit the PHC. So there are very less chances that anybody will go in for preventive checkups. So in the rural where this facilities, and they have to have multiple visits. So now when we say AI in medicine and the portable diagnosis, we refer to the artificial intelligence technology to analyze complex medicinal data, enhance diagnosis and treatment decisions, and patient monitoring. This will be achieved by the portable diagnostic tools, where medical devices that allow quick and efficient assessment of health conditions outside traditional healthcare settings, enabling timely interventions. When we say outside traditional healthcare system, is that the doctors will be there in the village, or you can say at your doorstep, so that the medical services can be given. Then we can have awareness at the community level also, where they will be encouraged to go in for preventive healthcare checkups. And this portable devices will enable the doctor to deliver it at places where there is no transport facility also. So we are encouraging, so in this model, we will be having a devices which will be assembled, and they will be given in a portable kit to the doctors, and they can take it to the remotest of the village where there is no connectivity by road. They can just carry it on their backpacks and go and take the diagnostic healthcare systems over there, and they can record the measurements or the things and come back. So the technology which we are trying to rope in is the machine learning algorithms, the IoT and connectivity things, which will be very effective in timely data sharing and monitoring the patient's health in the community. And at a central system, everything can be recorded. So that is where, when we are saying we want the healthcare providers or the doctors whom we are going to tie up with to have this portal and effectively use it. Then the user interface also will be very friendly for the patients and the doctors to be using it. So as we said, early diagnosis and continuous monitoring is also one of the aim which we are trying to focus. With the data collected from this method, we will be having insight into the patient's needs at that particular point of point of contact, and we can have strategies how to overcome that. And in the predictive analysis and personal health plans, if we find that the disease load or some symptoms are very common in one particular village, we can have a different strategy which can be suggested by the doctors panel in that particular institutions, so that they can give the healthcare facilities over there. So one of the example which I would like to give, when we were assessing a health science university in Karad, so we saw that they were facing a challenge, that they were having more patients who were getting diagnosed for cancer related things. So there were many mostly there were breast cancers and other type of cancers, oral and other things. So they were trying to develop a strategy how to mitigate this, but they didn't have a proper system. So then they were trying to have a model for this. So that is where we also suggested that you can adopt this methodology which we are. So they have also said, okay, we will be joining you if you have a proper kind of system developed and if it is effective. Then coming to, we also want to integrate telemedicine into it, so that remote consultation should be could be given to the patients over there. So there the treatment can be effectively done over there. And as I said, the health records which can be stored properly, and the patient information can be monitored, and the healthcare providers also can have a continuity of it, so that because people tend to not have the records with them properly, so when they are giving any treatment, so the things are very easy for the healthcare provider also. So coming to the implementation, what we are doing right now, we are finding sources for funding this project. And the major thing in the project is the portable kit. So the portable kit, there will be medical devices which will be identified. As I said, the two main things are the diabetes and BP related preventive things which we will be trying to uh, get it into it. So the devices which we are going to have, we are speaking to people who are having the capabilities where they have the diagnostic tools which are speaking to, which are AI based, and they also have developed some softwares which can monitor the patient's data and have a proper what do you say, connectivity between the portable devices and the softwares. So we one such person we have identified, which is in Ahmedabad. So they have the kit. And the next thing which we have also empaneled a board of studies or advisors. In this board of studies, we have medical specialized doctors who will be guiding us for taking proper steps in setting up the what do you say, the devices also, and the treatment which are uh, given to the people will be also verified by our team of advisors. And example, if we can give, we have Dr. Shirish Patil, who is a community medicine head, and he has been a vice chancellor of D.Y. Patil Navi Mumbai Health Sciences University. Then we have Ayurveda doctor, who is a dean of an institution, Dr. Sanjeev Yadav, and various other from MBBS we have. Then we have from dental, then homeopathy. So we have empaneled them and we are seeking their advice. And based on that only, we will be shortlisting the AI-based portable devices, which will be given to the students of health science. Now, when we say students of health science, these are the students who are registered medical practitioners, and they can officially take up consultation in the villages. As they are studying in the health science institutions, they are interns or PG students of health science institution. So we are going to tie up with them. So currently we are going to tie up with 4 to 5 institutions where we can have 4 to 5 villages where we can execute our model. So this health science institution, because why we are taking, because we want this model to become a sustainable, and we can have a proper kind of input given by the health science institutions to us also, and we can implement and measure the effectiveness of the AI-based portable kit. So when we say this health science institution, we are tying in the health science institution interns who will, as a part of their curriculum, they are supposed to go to villages and conduct camps, and also have health checkups over there. So they will be using our devices, which we will be giving them in a kit, and collecting the data. So that is where we plan to introduce this system to the health science institutions. Then after we empanel them, we will be training the health science institution interns and PGs by using this AI-based tools, so that they will they are the people who will be front-ending the system. So they will be given training for the how to use the AI-based tools and how to record the patient's information in that. And we are also tying up with hospitals for remote consultation. So these are so that, as we said, we want to give them what do you say, telemedicine consultation through this model also, so that any chronic diseases or lifestyle diseases which are at the advanced stages, we would like the consultation to be given at the remote place by this model. So, in this presentation, we are also appealing to the people who are attending that we want your suggestions and your support also, so that we can develop this system very nicely. And your suggestions are also welcome. So, I would just suggest if we want any help, you can contact us at edufuture.co.in, and or the Tech Forum also has information. So any question and answers we are open to take. And with this, I end my presentation. Special thanks to Dr. Ganesh Rajgopal, who has been our guidance and mentor for our Ready Future, and Dr. and Vishwas Kale sir and Vilas sir also, and Tech Forum and Institution of Engineering, Pune local chapter. Yes, thank you. Over to you, sir.
Okay, thank you, Swarupama, for this brief and nice presentation. We
Yes.
really appreciate your efforts. We will throw open the platform for question and answer, unless
Yes.
Ganesh has to make any remarks.
Yes.
Ganesh, would you like to make any remarks on this?
Definitely, yes. For example, what has been happening is there are certain couple of case studies which we have handled. One is, I can take the name, it is Taloja Jail. We were working on certain research activities in Taloja Jail on the inmates. What we found is subtly to be to the point, they are into lot of stress factor, because obviously, yes, if somebody is confined in a given area, they get into stress and anxiety. So because of this, they started abusing tobacco products. And since the tobacco products were made available for them to sort of be under control, unfortunately, the dentist college that we were working with, which was doing a part of the research with the Taloja jail inmates, 6 people succumbed to oral cancer. So now how exactly through this preventive healthcare which Swarupama was talking about, how do we identify first the mental health factor? That is also part of this particular aspects. So we are working on a research toward, and we wish to make this presentation to the government of Maharashtra, the Home Ministry, or a subsequent period of time. So this also will be spread across other states as well. Hopefully, we are working on that. That is one part. Swarupama did also mention in Karad. In Karad, what we found is, especially that particular area is completely of sugarcane, and lot of we have a lot of sugar refined industries over there. What was happening was people were exposed, where they were exposed to a lot of chemicals in the refined sugar. And most of them, quite a few of them, it is quite shocking when we went on a screening process, on a general checkup, we found almost 2 to 3%. I say repeat again, 2 to 3% of the total workforce in the first stage of cancer. We found out that because inhaling those chemicals day in and day out, we found that. Now, how do we really detect it? Because when the factory people were shocked, the owners of the sugar factory were shocked. So now that is other area which we going forward, that will be another component that we will be adding into our system. Likewise, we have traveled across Pan India. We have gone to many areas where we found that from a city perspective, yes, medical health and all is properly available. But when we go interiors, which is part of the syllabi, as Swarupama mentioned, for us students to complete the course, whether it is MBBS, dental, Ayurveda, whatever it is, we found that one, people hesitate to come forward to understand that they need to undergo a health checkup. There is some kind of a block. We don't know what it is. We're trying to work out on the block. Kidhar bhi gaya, like we had gone to in Meerut. When we had gone to Meerut, what was happening was when we visited a particular village along with the institution, interns and the doctors, they were hesitant to come forward because they always have a conception, they have a mindset. Doctor aa gaya to they will either put in an injection, those kind of factors are still existing. However, we claim to be advanced, however, we claim to be all AI, all of whatever we said and done. When they see a doctor, a perception happens with these people. Now, part of the study, which we are also doing with most of the institution, is how AI can really help. Where a person, he or she, a villager, can voluntarily come forward and say, okay, check me. Until otherwise, they get into a fact, they get into some kind of a health issue, is only then they visit a doctor. So this is something which we want to have a complete screening factor also, into this particular aspect. Then also what we found out is when we talk about medical institutions, out of every 10 students, I'm just taking a case study, out of every 10 students, the random sample taken, in this we find at least 3 of the students or 3 to 4 students are from families of doctors who are, have their own medical setups. It could be a hospital, it could be their own practices. That is one part. And balance of 6, what we found out is 2 go for higher studies. They can get into PG or any kind of a specialization. And out of the balance 4, one does it. It's quite hilarious, but we found it out. Of every one student who gets into a medical, they are more prepared for a marriage market. I mean, this is an honest, on the ground kind of a situation. The 3 people whom we are looking at, these 3 people have no idea what to do next, whether they have to set up their own clinics or they have to go for a job. There always is a mixed match kind of a confusion across pan India of most of the 60 medical universities and institutions we have conducted. So now we are aiming at these 3 people where we also are able to, through this kit, see that whether they can have their own placements happening or the employment happening, or mobile clinic, some kind of a concept that we are working on. So this we are of course discussing with Ayushman and Ayush people, how exactly we can also see that these 3 doctors, these 3 people who are sitting on a fence kind of a situation, how do we help them to take this forward, and how do we sort of connect them to rural centers, health centers and hospitals where a patient is diagnosed of whatever situation it is. As Swarupama said, we are starting with lifestyle diseases, then slowly graduating into cervical cancer for women, diabetic foot for men. We are working out all these things on a stage basis so that these people can get referral back into institutions and hospitals and so on and so forth. We also, like Swarupama did mention, regarding the cost factor of, as of today, a clinical activities. So when we are talking about this, yes, it is quite heartening. There are certain institutions under section most of the institutions are under section 8. So they also are ready to come on a kind of what we say that let's give free treatment to X number of people. Like for example, one of the institutions that we worked under Aadhaar, it's a name of a voluntary board activity where they are taking care of mentally ill and mentally retarded and autism children. So we are helping them to take how exactly these children, for whatever reason they have been dumped over there, it's very unfortunate, how exactly we can take care of them in the dental care. So we train, we help the dentists, including with the help of course, with the doctors, how to handle them. So for this, we already are talking to a certain health, mental health doctors who are in turn training the dentist how to handle an autism person. So autism person living unfortunately for the brain growth. Apart from that, they are very strong. So how do a dentist handle them? What are the mechanisms? So for this, how we are also bringing that activities into our kit. So these are the factors on a touch basis. I just the keeping the time factor in mind. I just put 1, 2, 3, 4, 5, 6. This is what exactly in further extension to Swarupama's presentation. That is it, sir, from my side. I just touched it or the touch base everything. But there are a lot of things to be done to really come out India as a healthy nation, mentally and physically. ये मेरे तरफ से sir. Over, sir.
Okay, Ganesh, thank you for this briefing. Yes, really appreciate the efforts and it's a great project. We will throw upon this platform open for question and answer. So plus identify yourself and fire your question. Over.
Prabhupada sir, I want to contribute something.
Yeah, please.
Actually, I already mentioned in the note our chat box that it is very broad vision project. Madam and Mr. has actually presented today to us. Okay, but still, I think there are some few things. He already mentioned about the mentally challenged and kind of people. Okay, but to me, uh, I still see that there is a social stigma on various issues of health related in the backward region or even in the developing, in spite of we are at the 2025 and we are talking about AI. Okay. And I am specifically mentioning about the leprosy still persists, still survives in spite of this. And madam, about 120 acts are against leprosy. Okay. And this has been noted by CGI Chandrachud. Okay. And if you could, at your social platform level, if you could add these things, okay, and the social stigma continues to the adolescent age issues, okay, especially for the girls, are still there. There is zero awareness. Instead of we talk about AI and 2025 developed nation and whatnot, okay. So please consider it. And now the new issue has raised up or cropped up. I don't know whether it was there earlier also, but it is now getting noticed. These are psychological and socio-psychological issues, and they are cropping from the childhood itself because we think that children are actually not so aware about, but they are more aware about nowadays. And the things are actually what you can say susceptibility of those age, that age is happening more now then, and you are started with some HIV, and now you are saying about the obesity and all that. All these things are actually, I don't consider it as a, I don't think it is more important than these I mentioned about. In 2025, if we could see that leprosy still survives and the social stigma still survives. So it is a total failure, I should say. Over to you.
Either of you can answer, Ganesh or Swarupama.
Yes, yes. We completely understand with the gentleman. We appreciate his perspective. Now, well, let me first admit there was certain audio, kind of a trouble. But whatever I have understood, I will just share my thoughts. Now,
Yeah, his name is Makarand Vaidya.
yes, more than apart from the name, sir, I was trying to understand what exactly because there was a audio disturbances from. I don't know. It was very
I will
muted.
talk to you later also. I will talk to you later also.
Perfectly fine. Perfect. So what just addressing this, sir, I completely understand the social stigma on certain acceptance of certain activities. We understand that. We understand that. So what we do is now part of the accreditation processes of all the institutions. Step one, for the third year, I'll just pick up MBBS. For the third and the fourth year, or the second and the third year, we create teams. We create teams of the students and we allow them to go into camps. We conduct camps. So when we conduct the camps, what we do is we properly and very subtly we identify first the behavioral pattern of a person. because these people are, since they're trained, we also take certain mental, rather psychiatrists along with us. So what happens is through the behavior part, first is we identify what exactly they wish to say or they wish to convey. One. After having said this, first is we, after understanding the challenges, first is we counsel the patient. Then we bring in the parents or we bring in the relatives and tell them this has happened because of XYZ factors, not putting them in a fright mode. I hope you understand, sir. Not putting them in a fright mode. Then slowly and gradually, then a lot of people open up and say, "Ha, मेरे को भी ये है, इसका भी था, उसका भी था." They start talking about it. So very certainly we have started this kind of an activity across pan India. One. Number two is I also would like to highlight and over here under the Prime Minister's office, there we have this capacity building commission. We call it as the CBC. And part of the CBC also is to identify and sensitize central agencies which are across pan Indian every state. Part of the extension activities, what we call them as, is also to look into the medical fitness of all these people. So at this point of time, we are doing a lot of studies and a lot of important outputs are coming. Subsequently, yes, given more opportunity to talk to all of you gentlemen, we really would love to share these outputs with you. So obviously, as you rightly suggested, we also are talking about how exactly we can work upon it. One, yes, I can see a question over here.
Sir,
Okay.
sir, before you transfer to the next question, I would just say, sir, your concern is well taken, but what we are trying to do, we are trying to first get into this model to a level where we are accepted in the community, sir. And that is, and the second level or third level will be getting into the because we have to establish a rapport with them, and they have to trust us that if we go to them, they will not give us any false information. As you know, as you said, mental health still is a stigma. Mental health is a stigma. So even in urban area, there are challenges of people accepting and going to the psychiatrist or say other disease and coming open up. So right now for our project, we are taking the first basic module which we are trying to establish, and then we will be if we are very much successful in the second and the third stage. The third stage will be as we have also plans for one-to-one remote consultation. So that is where we will be addressing those issues where they are not comfortable to go to the urban area and address these problems. So they can have the connectivity over there.
Okay, I'll just continue, sir, from what you mentioned, what the gentleman asked. When we talk about the mental health status, what also happens is, gentlemen, all of you will agree, part of MBBS is when they get into the second year and when they completely get into the third year, dissection is very important. Dissection of the body is the first they learn in the, under anatomy. So what happens is we have come across where students have completely gone into a absolute mental stress because nobody till that point of time have seen a dead body. And more important is dissecting the dead body. We have found it out. One. Second is there have been instances where students have started after seeing a dead body and the dead body dissection. We have come across in most of the institutions, students have taken to unfortunate wrong means of controlling the mind, like getting into drugs, getting into all such activities, and they get into a completely withdrawn status. So now we have worked out an entire syllabus. First is to tell the students at the first year itself and the second year, what we call as an induction or an orientation program, that this is how, this is part of you and I, this is what it is happening. We are working it out and we are monitoring them and see that first and the foremost thing, the doctor themselves are mentally fit to take care of it. There are certain cases that we have come across where students have even attempted suicide. They've attempted suicide. They get very aggressive. We have seen all this change. So now we have a syllabus with us which definitely is, if anybody is interested, we can also discuss the syllabus, what are the chapters that we're going to take care of it, in completely having a healthy learning mind for the doctors to become a good clinicians. That is part of it. So this is what asking. And Mr. Satish Mehta, you have talked about the cost. Yes, the government is sponsoring. The government is sponsoring all such activities. And now what also is happening is, now I come to the research perspective. Now there are a lot of medical pharmaceutical companies under the clinical trials. They are sponsoring institutions and specialized staff, doctors, in terms of understanding where how a research can be conducted, and they're sponsoring the entire research. And after the research has been done, then they say that that particular research, how it can be implemented through the institutions to all this area. This also
Ganesh sir, I think he is maintaining that the sponsorship for our project.
Okay, but again,
Okay.
this yes.
Sir, I would just like to answer this, sir. We are looking out for sponsorship at all levels from the government, private, and other partnerships also. And you have also said the thing, Doctor. I think Doctor, it is Satish Mehta ji, rural area connectivity problem also. When we are saying this, we have most of the areas now have mobile connectivity. So with this, what you say, devices, and what we are trying to have, this medical devices and AI connectivity, it will be monitored, or what you say, the interface, AI interface will be built, and it will be also available on apps. And currently there are few apps which some of the companies who are manufacturing this digital what you say, digital stethoscope or digital other measuring instruments, which are having that platform, and they can be properly managed through apps. So we are trying to minimize that also, taking those problems also. We have taken that consideration also. So that is also there. And Vijay Ghate sir has asked one more question. AI model. So right now, specifically, there is no AI model for a comprehensive kit which we are trying to build. There are some which have been developed as per the need of some clients. But what we are trying to work is at a very preliminary stage with that companies. So if we get any inputs, anybody having such devices, it is welcome, because the devices which we are aiming at are very basic level, but digitally monitored, and it can be, as we said, once a stethoscope is just used by the doctor, all the vital statistics is taken and feeded into the software directly. So there is no handling of anybody doing data entry or as such. So we are looking at such kind of portable devices. And as I said, the devices will be very compact, and they will be in a, they should fit in a suitcase at least, not more than that. So that it can be carried at a place where there is no access of four-wheelers or two-wheelers. On cycle also it can be taken. So this is what we are aiming at.
Okay, Swarupama, I just want to answer
Yeah.
this particular
Hello.
statement.
Hello.
The social and the response about leprosy. Perfectly correct. Now, what we are doing is, Swarupama did mention, now Government of India has encouraged that we have to consider two factors. One is what we call the traditional medicine. Number two, Indian knowledge system. Now we are inculcating these two mechanisms into our entire kit going forward, especially when we talk about leprosy. Yes, when we talk about leprosy, the sensitization, especially the adolescent age issue, is one challenge. Now, when we look into the disease existence, when we talk about the disease existence from a geographical perspective, so at this point of time, the institutions are working on it through traditional medicines, where Ayurveda, traditional medicines together can take care of this. One is the sensitization, second was identifying them, then how exactly we can go forward. It is happening, sir. It's happening. And thanks for the particular point. We are working on that also. But we have not sort of focusing on leprosy per se. We are generally focusing all such factors. Just before that, I would like to add a statement over here. In one particular place in Maharashtra, there is there is a social center. Very unfortunately, what has been happening is that people, it could be across anywhere, they just come and dump a child because the child is, or it is, physically challenged, or it has got a Down syndrome. It is unfortunately happening. So we are also working on that, telling them that anybody can, it is just nature. Any child can become, can be born with a Down syndrome, or over a period of time, they can develop mental or, challenges. And as of today, before the next part, I would like to add this also. What we find is, especially children using cell phones. In a study with Ayurveda, we found going forward in another 10, 15, 20 years in future, if it continues as it is, as of now, children looking into cell phone, because it takes 15 years for a human brain to form. One. Number two, once a cell is given to a child, two things happen. Over a period of time, by the time the child reaches 10, one, it can get into short-sightedness where glasses are mandatory. Number two, if not that, mental illness is guaranteed, sir. So we have predicted, it is so frightening, it is predicted that if every 10 children that is going to be born in the next 5, 10 years time, or whatever it is, 4 of them are predicted to get into mental illness because of cell. It's very unfortunate. And when we meet in person, probably I can share the research findings also to you through Ayurveda.
Yes, sir, a few more questions are coming up.
Yeah, please.
Give opportunity to the new questions. Those who have answered, rather ask questions, can be silent, and let us take the new people who want to ask questions. Please.
Namaste, my name is Anil Chaitanya.
Namaskar, sir.
Namaste.
Actually, I wanted to give some different information related to our area only. One excellent information you have given to us. The same time, I'm a part of Tech Forum, and I am associated with the insurance sector, health insurance sector. The health insurance sector are widely working in the same area to avoid unrequired hospitalization and avoid unrequired medical treatments. So in that connection, we are as a part of insurance industry, we are seeing lot of IO-based, artificial intelligence-based solutions coming out. Now you can be directly connected to the companies like a Star Health, where I am associated with. In that case, your data or company's data can we merge each other, and it's a plus for each other. Your efforts as well as company's efforts. That's what I want. That's what I wanted to just give an information. Another thing, like for autism, there is very, very, very low premiumed policies, insurance policies are available. Unbelievable low premium policies for autism childs. So that can be informed to the industry or concerned persons, which they can buy that insurance cover and pay back by way of refunding your expenses to you. This is also available. As well, there is another insurance cover available for disability. Almost 40% plus any disability declared by the government or the government hospital doctor, which is on paper. This policy is provided, which is very low priced, which include in even Parkinson's disease like acid attacks and thalassemia and something, which are many areas, more than 21 areas are covered. Now, this type of policies are low benefit price, so people are not talking much about it, but they are very useful to the community, like a community where you are working in. So I wanted to share this information wherever possible. We can talk on this and give more additional information to help you out this. And thank you very much. There
Yeah,
are
thanks.
many
Thanks, Anil.
IoT-based things are coming up. You can interact with such companies, which will be beneficial to both of you. Thank you very much.
Thank you, Anil, for this wonderful information.
We are
Thank
very
you.
much
I think
honored,
Vijay
sir.
Gate wanted to ask some question.
We are very much honored, sir. We are very much honored. Definitely will come to you, sir.
Yes.
Yeah. Yeah, let's go for the next question.
Yeah, Vilas, this is Vijay
Yeah.
Ghate.
Yeah.
My question actually was about AI models and not the device models so much. So when you say predictive work, predictive AI, what is it that you intend to predict? Like possibility of blood pressure developing when person doesn't have symptoms of blood pressure right now? Or is it possibility of coming out of that disease? Say diabetes, if he doesn't have diabetes right now, but developing a diabetes eventually. That was my question. So what sort of models, what are you predicting, and what is the input data that you are going to use?
Yes, sir. Swarupama, will you answer? Should I answer that?
Hey, you answer.
Okay, that was a very to the point question, sir. Step number one is when we talk about preventive. So preventive is something which I go and talk to an ex-person. And as you rightly did mention, we will tell them the chances of, let us take diabetes. Now, when we take diabetes, now it is a lifestyle disease. So one, we will through this as through our model, we will just say what are the possibilities of that ex-person getting into diabetic over a period of time. That is one way of telling preventive medicine. Second one, what you did mention is after a person, let us say during course of our validation and verification of a person, if he or she has already been diagnosed or in the verge of getting into the borderline of diabetics, then we give them a curative kind of an activity which we will refer them to these centers. So one is preventive, to tell them how to live a better lifestyle. Number two is if diagnosed of whatever stage of a diabetes is, then refer them to the right doctors for curing. This is 1, 2, 3 factors, sir. Very simply put it.
Okay, thank you very much.
I think, yeah, that answers most of the questions. What Tech Forum is doing in this regard? Medical devices group we have formed, and we have some ambitious plans. I will request Mr. Surendra Agarwal to say a few words about our medical device group and plans that we have. Over to Mr. Surendra Agarwal.
Thank you, Vilas, for inviting me to talk about Medical Device Forum. Actually, Medical Device Forum has been formed to help the medical device manufacturers manufacture the device at a substantial reduced cost. Because what is happening is in this competitive world, we are not able to compete with the Chinese products and things like that. So Government of India is promoting medical device park where there'll be central infrastructure to help out in terms of prototyping, 3D design, particularly logistics and warehousing and component testing that will be centralized. And also they are offering land at a very cheap rate, at a rate of about ₹1 per square foot, and electricity also at ₹1 per unit. So all these things we are going to help the device manufacturers to basically reduce their costs substantially, and also in helping in marketing, because most of the products, this particularly when we are talking about portable devices, there are already a lot of portable devices available for diabetes, then anemia, pregnancy, etc., etc. But the marketing is suffering. I mean, they are not coming out in the market the way they should be. So this medical device park will have a central marketing team, will also have, tie up with the multinationals, etc., etc. So we are trying to promote it, and we are looking for about 20 device manufacturers who may be interested in joining this initiative. With that, we'll propose to the Government of India to help us in setting up, to basically sanction a medical device park. Because at the moment, Government of India has sanctioned medical device park for three states. One is Madhya Pradesh, other is Uttar Pradesh, third is Tamil Nadu, and fourth is Himachal Pradesh. I don't know why Maharashtra has not been chosen. But I think we should put our efforts through the Maharashtra government to medical device park, because the medical device park in Uttar Pradesh Express Highway, Yamuna Express Highway, it is already 300 acres, and now they are going to go for another 200 acres, and because 75 device manufacturers want to join it. So that is our thing. And second thing is that we want to help the startups, in this area of device manufacturers. I presume that this is a good startup, but what my suggestion will be that a startup has to have a good team, at least 3 or 4 people. One should be CEO, one will be CTO, one should be worried about the financing part, etc., etc. And once that is very important to have a dedicated team of about 4, members, key members, and then make a prototype of this device. There are a lot of institutions which are helping in terms of making a prototype, offering 25 lakhs, etc., to the good, innovative ideas. And third is that, already the devices are available. Maybe you may like to join with those people who have already developed it and make it, with your got a lot of field work you have done, lot of data you have got in terms of. So why don't you join hands with those who are already there and, take it and make it more impactful. For example, ASHA workers which are there can be very helpful in these areas, whichever we are talking about. So this is in short, which I like to say, that it is a good startup, but startup has got a lot of pains, a lot of things you have to go through it. And I'll also suggest that, the name of the people who have already developed these devices, that you try to talk to them and find out what is there instead of inventing the wheel again. Thank you so much. Bye.
We are very much honored, sir. Your statement is very, very positive. And in fact, you have helped us to quantify our time very properly. That's what I look into. And that was the last wording that you made. Reinventing wheel. Absolutely, we are with you, sir. We definitely would love, from a company perspective, at your convenience, at your time, we really like to meet you. And further, we can definitely discuss in talking to certain select people whom you tell you talk to them in terms of the equipment. Definitely, sir. We are open for that.
I'll be happy to meet you and guide you out. So,
thank you, sir.
I've been guiding startups, at least 100 startups I would have, brought them into
amazing, amazing, sir. Amazing. Sir.
I've been in this field of startup for the last 22 years, though I am an IT guy and I know AI very well.
Wonderful, sir. We definitely would love to meet you at your time and convenience, sir.
Okay.
We'll just keep in touch with you. We will definitely love to see you, sir.
Welcome.
So we are coming to an end. It was a very truly interactive session today. I must appreciate Swarupama as well as Ganesh for making it more interactive, and all the participants, particularly to thank them. And definitely the Tech Forum will pursue this idea of Dr. Surendra Agarwal to proceed for this medical device.